Hello people, in this video we are going to look at medulloblastoma. Medulloblastoma is an intracranial tumor, right? So it's something like the brain tumor. It is poorly differentiated embryonal tumor. What do you mean by embryonal tumor? Some primitive tissue is forming this tumor. So that is why this name blastoma, embryonal tumor, blastoma. And as it is embryonal, it will affect whom? The children. So mostly it will affect children, okay? So what is medulloblastoma? It's a brain tumor or an intracranial tumor. It is an embryonal tumor. That is why the name blastoma. It affects children, correct? That's all as an introduction. Moving on. So basically in intracranial tumors, you have so many types of tumors, right? But here we are looking at the embryonal tumors only. Under embryonal tumors, there are a lot of tumors, okay, embryonal tumors like medulloblastoma you have seen now, we're going to see now, glioblastoma, neuroblastoma, retinoblastoma and PNET, that is primitive neuroectodermal tumor. See, everywhere there is blastoma, glioblastoma, neuroblastoma, retinoblastoma and primitive. Primitive again means some primitive tissue. So you can understand the names, right? Because it is embryonal tissue, some primitive tissue it is. So there will be medulloblastoma, etc. So many other blastomas, okay. So these are primitive tumors of the CNS, okay, central nervous system. We want to discuss only medulloblastoma in this video, correct? So medulloblastoma is the most common primitive neuroectodermal tumor occurring in children. You should say this. You should be able to say this. Say it. Medulloblastoma is the most commonly occurring primitive neuroectodermal tumor. Ectoderm. Obviously, you know that the neural tissue is coming from ectoderm. So, neuroectodermal tumor occurring in children. The most common location is cerebellum. That is what you have to focus on now. So, now if this is the brain, where is the cerebellum? Here you have the cerebellum. So, basically this medulloblastoma arises from where? It arises from this location, cerebellum. Shall we move on, guys? So, are you able to understand what we are studying today? Today we are studying medulloblastoma. It is an intracranial tumor. Basically, it is from primitive tissue. It's affecting children. Then it is a common condition in children. It is arising from cerebellum. Okay. So, the tumor is adjacent to the ventricular system. So, you can think where the ventricular system is, right? So, it is adjacent to that. So, if this is the brain, right, here's the ventricles and here's the cerebellum. So, it is adjacent to the ventricular system, right? So, therefore, these cells can infiltrate into the CSF. So, when you do a CSF examination, you may be able to detect these cells, okay? Now, it is the most common variety of primitive neuroectodermal tumor, you know. Then common location is cerebellum, then roof of fourth ventricle, midline of cerebellum, don't forget this, midline of cerebellum. Cerebellum, you know, midline of cerebellum. In the vermis, in the cerebellar hemispheres. So you cannot remember everything. At least you will remember what? You will remember cerebellum, midline of cerebellum and the, what was that? Hemispheres of cerebellum. Okay, cerebellar hemispheres. The most affected, genetic here feature is the chromosome 17, guys. So, chromosome 17 is affected in what? Medulloblastoma. Chromosome 17. I am 17. Chromosome 17. Okay. I am not 17. Okay. So, now let us go to chromosome 17, what? Medulloblastoma. Got it right? Chromosome 17, medulloblastoma. Moving on. Now, it is a malignant tumor. You should know it's a malignant condition. It can spread from the local to CSF from CSF to meninges, from meninges to subarachnoid of space that itself has CSF, then extraneural sites like lungs, liver, vertebrae, pelvis. So, from the cerebellum, it went to this ventricles. So, ventricles, CSF. From CSF, it will go to the meninges. From meninges, then it can go to lung, liver, etc. Okay. Are you ready to go to the gross and see how the gross of the medulloblastoma will be? Okay, so basically we have taken information from two textbooks, Robbins and Harshmohan. This is actually a photo from Robbins. So here you can see the cerebellum, right? And here you can see the lateral ventricle. This one is the corpus callosum, correct guys? So here you have the lateral ventricle. So lateral ventricle, third ventricle and fourth ventricle you will have, correct? Now basically here they are saying that in children the medulloblastomas are located in the midline of the cerebellum. So in children the medulloblastomas are located in the midline of the cerebellum, but lateral locations are there in adults. Okay. Then the rapid growth may occlude the flow of CSF leading to hydrocephalus. So there will be rapid growth. It's highly malignant. So it may occlude the growth of occlude the flow of CSF. The tumor is often well circumscribed, grey, friable. Okay, grey and all this you should write all the standard. No, always you will write grey, whitish yellow. All these colors are very standard. Here you write grey. Okay, well circumscribed. Though it is malignant, it is well circumscribed. So this is what you have to focus on. Then it is friable, right? And it may be seen extending to the surface of the cerebellar folia and involving the leptomeninges. Leptomeninges are the inner meninges, correct? So it protrudes into the fourth ventricle. Soft grey-white mass invades the surface of cerebellum. That's why it is malignant, right? So we are done with the gross, guys. How was this gross explanation? Was it fine? Did you like it? Let's move on to the microscopy now. So this photo is taken from Robbins Pathology. Here you can see some rosette formations, guys. So basically these are the characteristics of medulloblastoma. So medulloblastoma microscopically it will be cellular, sheets of anaplastic cells will be there. So a lot of anaplastic means poorly differentiated cells will be there. These cells will be small. They'll have very little cytoplasm and have hyperchromatic nuclei, okay, which will have obviously standard features of malignant cell, hyperchromatic nuclei. Scant cytoplasm they are saying, and small cell, poorly differentiated it will be. And there will be psuedorosettes. Guys, this word is very important, or Homer Wright rosettes. Very important. Pay attention here. This is a very important word you will write for medulloblastoma. Okay. Pseudo-rosettes, Homer Wright rosettes. So basically medulloblastoma is composed of small cells poorly differentiated with ill-defined cytoplasmic processes and has a tendency to be arranged around blood vessels. They are arranged around blood vessels. That is why they are arranged around blood vessels. Remember? And they form pseudo-rosettes, Homer Wright rosettes. See if you can spot these, guys. There's one here and one here. This one is actually very clear, right? Okay. So that was the microscopy. Let's see some more details. There's one term here called as drop metastasis. Read this. Dissemination through CSF is common complication presenting as nodular mass elsewhere in the central nervous system, including metastasis to the Cauda equina. They are sometimes termed as drop metastasis. So if it metastasizes to the Cauda equina, then it will be called as drop metastasis. Okay. So if you want, you can remember this. So this was about medulloblastoma, guys. So just look at the keywords that you have studied in medulloblastoma. It's intracranial tumor, embryonal tumor. So it affects children. It's going to be having the primitive neuroectodermal tissue. It is going to be coming from the cerebellum, midline of cerebellum in children and lateral parts in the adults. It's adjacent to the ventricular system, so the cells will shed to the CSF. CSF examination may help. The most common genetic feature is the deletion of the 17 chromosome or isochromosome, something of 17. So basically 17. Then it's a very common tumor, malignant condition it is. And from the local, it can go to CSF to meninges to the ventricles to subarachnoid space, tendency to spread to the other places like lung, liver, vertebra, pelvis. There can be drop metastasis to Cauda equina, right? You should write that. Cauda equina actually is part of the spinal cord, guys. That horse tail kind of a thing from the spinal cord. So basically, remember it is dropping from the central, from the brain, cerebellum, ventricle, it is dropping till the Cauda equina. That's why it's called as drop metastasis, I think. Okay. Then you saw that gross, you will see what is affected. Midline of cerebellum, it will occlude the CSF flow. It will be well circumscribed, grey, friable. And midline of cerebellum, grey, white, all that you will write. soft, invades the surface of cerebellum. That's why it's malignant. Then we saw microscopically sheets of anaplastic cells. Mainly this, they are arranged around blood vessels to form pseudo-rosettes, Homer Wright rosettes. The cells are small. They are arranged around the blood vessels. They have scanty cytoplasm, hyperchromatic nuclei, etc. Then what else you saw? That's all, drop metastasis. Okay. So that is about medulloblastoma, guys. So we will meet you in the next video. Hope you have understood medulloblastoma. Thank you for joining. Bye bye.